Now, 6 bands common to Lyme. If one has, or one or more of them, are they positive? Okay, I showed you the ones. Band 41, and I don't care if it's from the Mardex blot, which Quest and LabCorp use, our blot, or anybody else's blot, Stony Brook's, anybody. Just 41 just means you have some type of bacterial infection or something else going on, probably maybe a virus, but mostly a bacterial infection. It is not specific for Lyme. Okay? Now, if we find it in relationship to one of the specific bands for Lyme, the laboratory can make the decision and make the leap of faith, and it's an accurate leap of faith, that that band 41 was due to a Borrelia of the 4 strains infection. So that 41 combined with another positive band that's specific for Lyme means you've got an active infection of Lyme. Okay, so there are 6 bands, and I showed you the changes. Somebody, I hope, was awake. Okay, is indeterminate the same as equivocal? Yeah. It means it could be, might not be, but there's something going on. What it really means, and I like people to think of it, your immune system's trying to respond. Something's going on. And if it's at a specific band for Lyme, that means you've had an exposure to Lyme, and your body is either trying to or has had tried to, wants to respond, but hasn't been able to give a strong enough response to be positive and go positive. We find that in a majority of patients, when they get an indeterminate, if they get antibiotic therapy, those bands will usually go positive 2 to 3 months later. And I'm not advocating extra testing here. This was only in the research that we've done. If you find those indeterminates, and the doctor makes the clinical diagnosis because he knows how to read our blot, and he treats you, I do not think you or should have any more testing to repeat it again, because there's no test for proof of cure, because I know that's the next question. So there is no test, no matter what anyone wants to tell you, of a proof of cure. The only way I can do that is to take every piece of your body and do PCR on every piece. That's kind of illegal in the United States. So, if you are positive for autoimmune disease, what bands can cross-react? I presented a number of the 15 bands that the CDC saw. About 8 to 9 of those cross-react with autoimmune diseases. So yes, you could get a false positive using the CDC criteria. So that's why they say, oh, you can get a false positive? You betcha. Because you could have 41, 45, 58, 66. Voila, that would be positive by CDC. None of them are specific for Lyme disease. You get a false positive in none of the cases. So that's why you've got to be careful about what bands are what. And the bands that are specifically for Lyme disease, not tick-borne relapsing fever, but the other strains I talked to about are 23, 34, 39, are the 3 that we know in the IgM are absolutely specific. Now, 31 can cross-react with an Epstein-Barr infection, or if you ever had one of the vaccine, the LymeRix vaccine back in the 90s and the early 200s. That will always bring up a positive 31 band. 8393 does cross-react with a few viruses, and that's what we're finding more and more now. And I don't know if it's because of the immune systems of patients getting weaker over time, but we are seeing more of 8393. So about a year ago, we actually had to stop calling it 8393 and a 41 positive for Lyme. It now has to be, we call it negative, because we're seeing way too many non-Lyme infected people coming up with those 2 bands. Does the CDC believe its own malarkey? Are they purposely putting out false information? Ooh, ooh, you know, they're recording this. I've already got a target on my back here, you know? Look, I believe that the IDSA, and even though they would think I'm the Antichrist, I actually believe that a number of those doctors try to do the best they can with what they've got. I'm not saying that others don't let their egos and the air in their ivory towers, which is very thin, get to them. I don't know, but do they believe it? Oh yeah, they drink the Kool-Aid. What do you suggest to getting attention around the testing legislation as a New York resident? Move. Okay, you've got to get an address outside New York State. There's nothing a good physician in this state who wants to keep his license can do about it. He's already up against the wall. Good guys like Dr. Stram and the other men that you're going to hear today, they are putting their licenses on the line every day, and they cannot afford to offer or do a test that is not approved by your state. And like it or not, your state doesn't believe any other organization in their licensing, regardless of how many other states we're licensed at and clear and pass all these accreditations around the world, not just in the United States. Their New York State sits there in Albany and tells you nobody else knows how to do lab medicine but us. And if we don't approve it, it ain't good. And that is one of the major anchors you get to carry in this state. The science of new testing. We've had a fish technology out there for 8-9 years. You can't get it in New York. We've got other tests that have, the Miyamoto testing. PCR, a PCR test, for God's sakes, it's DNA. We can't get that approved in the state. I mean, so yeah, we got a way to go here. Move. So if someone has a true bite, develops a rash or not, should they start antibiotics right away as too hot in this area and wait for it to develop into the bloodstream? I wouldn't wait. I got a rash, I got a tick bite. The first thing you should do though, when you kill the tick, I know you want them sent to you, but I'm going to tell you, if you take the tick and you send it to the University of Massachusetts, they will do, for I think it's either free or maybe it's $25, and they will do PCR on the tick. And they will look for Lyme, Borrelia burgdorferi, and it picks up the other strains, the DNA, the sequences they use are okay. It'll pick up Anaplasma, it'll pick up Ehrlichia, it'll pick up Babesia, and it'll pick up Bartonella. They'll test for all the major co-infections along with Lyme. And you'll get the result back in 2 days. Okay? And so don't send it to IGeneX. Yeah, we take 2 weeks. I don't know. We're California guys. They lay back. You know, what are you going to tell you? The water's on the wrong side. So they send it to University of Mass. And then again, if you also want to get it for free, Bay Area Lyme sends it to Arizona, which I can't understand why, but they do. And the University of Arizona, because there's no Bay there. I've been there. I got to go there in 3 weeks. So, but they'll do it for free. They test for 4 also. So you can go either places. UMass does a pretty good job, even though the infectious disease guys there have my picture up with a bullseye on it. So, yeah, last one here. What do you suggest getting a row? You already did that one. Okay. Okay. Perfect. Oh, sorry, I missed it. Sorry. PCR not allowed in New York. Skin biopsy PCR. What is being done to get New York caught up? We keep submitting. Okay, our Dr. Shah is a wonderfully patient woman, as a good Harvard-trained PhD should be. And her patience had her working closely with a number of scientists up in Albany at your CDC and your Department of Health. And we are moving in the right direction. We actually, we're going to have a few of these fish test technologies available, allowed, and blessed by your departments very soon. PCR, it should have already been, but we're getting there as fast as we can. Go ahead.
What are the actual logistics, the mechanics of getting a tick to UMass? Like,
okay,
who does it go to?
First of all, you got to have a computer. Okay, you go to your computer and you put in University of the Google search, University of Massachusetts tick testing. Okay, it'll bring up an address and the directions on how to send it. Okay, even I can do that. Okay, and as you can tell, I'm pretty illiterate.
Let me just say, it's $50
Oh.
for Borrelia, and it's $100
For everything. Oh, they raised their price.
Very rapid, and you can get the results within 2 to 3 days.
Perfect. Sorry it's a money, but guess what? It's better than putting everybody on antibiotics high dose for a month. because there was a publication in 2002. So if you walk into your emergency room, this is what happens to you because of a letter to the editors by Gary Wormser in the back of the New England Journal of Medicine on October, the first week of October of 2002. Gary Wormser, who's chief of rheumatology at Westchester, went out and said down to his ER guys, which he could beat up on because he's head of rheumatology, and he had them all say, if a patient comes in here, and this is in May and June, comes in here with a tick bite, I want you to give them a shot of doxy and a tablet to take home and get me their phone number. In August, he called 100+ patients who had all had this done to them. They all said they felt better. So he wrote a letter to the New England Journal of Medicine, and it's in the back there, and he described that and said, this might be, and I'm going to give him the threat, this is truth. He didn't say it worked. He said, this appears to be an effective tool to stop the infection of Lyme disease. And the trouble is, the emergency room guys grabbed onto this without other research, and they started doing it. When you take a low dose, quick dose of doxycycline and have an infection of Lyme, it affects your immune response. It's going to affect the lab testing, and guess what it's going to teach how to protect. Borrelia burgdorferi is going to learn real quick what doxy looks like. And it's going to go immediately into tissue and hide. And when it sends out, and talk about them, these little pieces of DNA plasmids out into the blood to check how your immune system's working, it's never going to come out of the cell until your system is so low that nothing's going to hurt it, and it's going to come back into your blood and then spread. But that's what you get when you do that. And look, the ER guys are under the gun. Because when someone goes to the emergency room and they have a tick bite, and they're made to sit there because somebody with a heart attack or broken bone is going to make them sit for 3 hours while they take care of the real emergency as they see it. When the marketing department at the hospital sends out their review to the patient, how did you enjoy your trip to our emergency room? They're going to say, I sat there with 3 kids for 3.5 hours, and I was gone, and then they sent me home with nothing? That's horrible. So the ER guys are under the gun to do something. So they grabbed onto this like a straw that they, grasping for breath, and they started giving everybody this low-dose doxy. It's evolved into just giving them 2 tablets now in many cases. I know some emergency rooms, like up in Poughkeepsie, 1 or 2 of the hospitals have actually listened to Dr. Horowitz, and maybe to me and to others, and the infectious disease doc, well, one of them up there, listened, and some of the hospitals have stopped doing that. But if you walk into the ER and they want to give you 1 or 2 doses of doxy for Lyme, don't. Our lab is not going to be able to help you, and you are just going to confuse the diagnosis, and 6 months later is when you're going to feel bad, and now not only me, but your physician's going to have a real hard time. Okay?
Hello. Hello. Oh, over here. First, I want to thank you. It was the best $400 I spent about a year and a half ago to your lab. I had 4 false tests. Lyme was never on my radar, and then I found a local doctor who said, you need to send your blood to IGeneX, and $400 was like, I don't have that much money right now, but I said, screw it, and it's the best $400 I ever spent, so thank you for your lab.
Thank you for putting up with that.
My question is, I'm just curious, because I brought my parents today. I know it's hard to get a concrete number, but I know from 2013 to 2014, it went from 30,000 to 300,000, right? If you had to make a guess or through your research, how many people do you believe in this country come down with Lyme disease? Because I'm not considered in New York State. I'm not considered a person that's positive. What's your guess? Like, is it a million? Just a rough number? I'm just kind of curious.
Yeah, probably in that range. Probably a million, yeah. Yeah, this is the worst, and it's going to get worse. This epidemic with tick-borne relapsing fever, they're not even looking for it in the western half of the United States. And it's endemic everywhere we look in the western half. Not us, look, the CDC.
Right. Well,
Sure.
the CDC number for, I think it was 15, or 16, was approaching 400,000. It's 380 something.
386,000.
Yeah, 386, the boss said. And Bob is absolutely right. That excludes many cases of Lyme disease from non-endemic areas. And
Yeah.
so it's probably double.
And it excludes
Good
any
guess.
physician who doesn't dare go up against his medical review board or his own colleagues. who's terrified of losing his license or his referral capabilities. You know, you don't want to be the one doc who you can't go on vacation because no one will watch your patients. You're not invited to meetings or conferences with your old friends because you're the Lyme doc.
Thank you very much, Bob. It's time for us to wrap up our
Oh,
questions.
that's okay. I'll be hanging around. Thank you. Thanks for listening.